Mr. Ravenswater.
That's right.
Richard. My name's Celia, and I'm going to be looking after you today. Okay? Right, I've just got your medications here to take. Can I just check your wristband?
What's that then?
Richard Ravenswater.
I just told you that.
Your date of birth?
31st of 10th, 52.
That's correct.
Of course it's correct.
Right, I've just got one tablet here for you to
I'm
take.
not taking that from you.
Richard, it's really important. It's an important medication.
You're poisoning me. I'm not taking that.
Look, the doctor's prescribed it.
Can't bloody see that.
See, it's your name, date of birth, and it's prescribed you this one tablet to take. It's really important that you take it.
You're poisoning me. Get lost.
Okay, don't get distressed.
Distressed?
Is your wife coming in today?
Anna's coming
in. Right, shall I leave it and speak to Anna and we'll give it to you when Anna's here? Will that help?
I'm not taking it.
She can explain to you.
I'm not taking it.
Okay, well don't get distressed. I'll come back later.
I'm not distressed.
Okay.
Hi Celia, everything okay?
Oh, Phil, just the person.
Oh, go on, what's up?
Well, this patient, Mr. Richard Wave.
Oh, yeah, I know Richard, yeah.
I can't get him to take his medication at all this morning.
Isn't he on a Pixaban?
Yeah, he is.
Yeah.
I've tried to explain that, but he just says he doesn't know me. He's agitated with the environment and thinks I'm trying to poison him.
Oh, gosh, right, okay. Yeah. Would you say you've got capacity at the moment?
I wouldn't, no,
okay.
Definitely not.
Right, what I'll do is I'll go and do a formal capacity assessment in relation to his medications. Could you do me a favour? Can you ring his wife Anna and ask her to come in? Now, she doesn't drive, so she'll probably need to get a lift, so give her a bit of time. But if you can do that, I'll pop and see Richard and take it from there.
No problem.
Lovely, thank you.
Thanks, Phil.
Hiya, Richard. Do you remember me? My name's Phil. I'm one of the nurses that work at the Trust.
Don't think I remember you.
I think we've met a couple of times. Oh, don't worry, once seen, easily forgotten. How are you feeling this morning?
I'm all right.
Yeah, okay. I've just bumped into Celia, who's the nurse looking after you today, and she's a little bit worried because this morning you didn't take your medications that you normally take. Do you remember that?
Don't
remember that? No, okay.
No.
It's just that these medications that you're on are really, really important, and they keep your heart nice and strong, and so it stops you having any problems ongoing. And there are some significant problems that you might have if you don't take your tablets.
Okay.
Yeah, like a stroke, something like that.
Stroke?
Yeah.
Okay.
So we're keen to know, is there a particular reason why you don't want to take your tablets here? Is there anything we can do to help?
I just don't know you. I don't know you.
Yeah.
I don't know any of you.
Yeah.
Look at this place. It's confusing.
Yeah.
I just don't know you.
Okay. Have you ever been in hospital before, Richard?
I had some stuff with my teeth, I think, and something about a tube.
Yeah. Oh, yeah. You're coming in for some tests for your waterworks, I believe.
And there's blood.
Yeah, blood in your waterworks.
Some blood.
Yeah. Okay. Well, we can get that sorted for you. But at the moment, you're just in hospital at the moment, and we need to try and get you to make sure you take your tablets. It's really, really important. So what I've done is I've asked Celia if she could ring your wife Anna.
Anna, yes.
Yeah, who I've met a few times. Who's lovely.
She is.
Yeah.
She's great.
So I think Anna's going to come in with her sister Claire.
Anna and Claire coming.
Yeah. So I'm going to have a little chat with them about this medication issue because I'm a little bit worried about it. I want to make sure that you take your tablets in the best way that we can sort that out. I know Anna, she's lovely, isn't she?
Anna's great.
Yeah, she's great. Does she help you with your tablets at home?
Anna helps me with everything.
Does she?
She
Brilliant.
does.
She's the right woman to talk to then, definitely.
Anna is the right woman to talk to, yeah.
Perfect. Well, I think she's coming in with her sister Claire. So,
Anna and Claire are coming in?
Yeah. So I'll have a little chat with them first, and then we'll come over and have a chat with you, and we'll come up with some sort of a plan. Does that sound okay?
So Anna and Claire are coming in?
Yeah.
Good.
Okay, brilliant. All right. Leave it with me and we'll come back to you shortly, all right?
Okay.
Lovely. Thank you.
That's okay.
Hi, Anna. Hi, it's
Phil.
Phil.
Nice to see you again.
Yeah, lovely to see you. Thank you so much for coming in. Who've got here?
This is my sister Claire, sorry.
Hi, Claire. Phil, nice to meet you. Hiya.
Nice to meet you.
Thanks ever so much for both coming in. We've had a bit of a problem with Richard this morning. Celia, the nurse that's looking after him this morning, tried to give him his tablets and he was absolutely having none of it. He knocked the tablets away and was really, really distressed. He said he thought we were poisoning him. As you know, he's on a Pixaban, obviously a critical medication. We really need to make sure and find some way through this so that he can take his tablets whilst he's in hospital with us. I've sat with Richard and just trying to find out a little bit what the problem is maybe. He couldn't remember not taking his medications this morning. He feels it's in a very, very strange environment. He's not comfortable at all. He doesn't know me, he didn't know Celia. This is kind of all the issues. I went through the risks and benefits of taking the medications, and I'm pretty sure that he didn't understand, or basically because he couldn't retain the information.
He was like this before, wasn't he?
Was he?
When
Yeah.
he came into hospital for his teeth.
Right.
Anything out of his ordinary routine.
Right.
Sends him really.
Right,
He
okay,
struggles
okay.
with it. He got much more confused out of his normal routine.
Yeah,
He really got quite anxious.
Yeah, well, he said, I don't know who you are, I don't know where I am. He was really sort of environmental pressures, I think, were really, really difficult.
Yeah, he talked about people poisoning him, trying to poison him.
Right,
then,
exactly the same as this morning.
Yeah.
So was there anything you did last time that enabled him to take his tablets easily?
Yeah, I think we did, the doctor at the time talked to us about it, and I used to come in and try and support him with it because it's not a problem at home. It has it's part of his normal routine,
of course,
so it's fine.
yeah.
But then on the times that I couldn't come in because I don't drive, so I'm very reliant on people bringing me.
Yeah.
They used to put it in a pudding because he's got a sweet tooth. So
brilliant.
I was really I don't want him to have a stroke. So
no, of course,
it's a question of him not having the medicine or having a stroke, then I'd rather get the medicine.
Perfect, yeah. What that we sort of call that covert medication. Right. So give them covertly in his best interest. Yeah. Okay. Well, there's obviously paperwork to fill in like there is in everything in hospital. So I've done the capacity assessment on Richard, and I've deemed him to lack capacity in relation to this decision, because he can't retain information and weigh up the risks versus the benefits. So then we go on to have what we call a best interest discussion, which is exactly what we're having here. Part of that, and I don't know whether you've done this when you had his urology appointment, is to demonstrate that you agree it's in his best interest to give his meds covertly.
Yes, I did.
And completed a form.
Yes, okay.
You probably recognise the form. Okay. It's just your name, that your wife, and that you agree it's in his best interest.
Yes.
Is that something, Claire? Yeah, okay. This isn't legally binding or anything, just basically demonstrate that we have these conversations. Yeah, okay. And the important thing is that Richard gets his medications.
No, absolutely.
Have you filled in or helped Richard fill in the information about me to help you document that we have as part of our dementia care bundle?
Is that? I think I did last time he was in hospital about what things that might make him more anxious and how I help with that at home. I did last time, but I haven't done it this time.
Maybe when we go out, if I ask Celia to give you one for this time, and we can just put it at the end of his bed, so people that are looking after him have got a little bit more of his little idiosyncrasies and that kind of thing. We can get that all done.
He's got lots of those.
Yeah, haven't they all? Yeah. So that would be wonderful, and then we know then that's been
no,
the
that's
plans
fine.
in place.
I'll do that.
That's
definitely.
Lovely. Okay, super. Well, that's great. So I said you were coming in. He knows you're coming in. So if you want to go and visit him now, that would be great. I know it's outside of visiting times, but we don't mind when people with dementia.
Probably let me give him his tablets now I'm here.
Perfect.
It's not too late.
Okay. Well, what I'll do is when I leave here, I'll go and tell Celia to sort the medications out, and we can give it to him while you're here, and then hopefully that'll start easing his distress around medications. But as you say, it's really important that he gets them, so we'll just kind of do everything we can.
So this is like a bit of a backup, isn't it?
Yeah, absolutely. Yes,
okay, that's okay. Isn't it?
Yeah. Lovely. Okay, that's great. Thank you so much. Thank you for coming in as well. And
thank you for your time as well.
Did you manage to park?
Just about.
Yeah, that's always an issue.
Well, Claire's driven. So,
brilliant. Okay, lovely. All right, well, thanks again, and we'll get this sorted. And if you can document that for us, that would be absolutely brilliant.
Definitely. Thank you.
Thank you. Thanks very much. Lovely to see you.
Thank you.
Thank you.